The 16-year-old girl is brought to the physician by her mother who is worried about her daughter's rapid weight loss. Okay, then erratic behavior. The girl states that she has been exercising frequently and has not menses for the several months. Upon further questioning, she reluctantly states that she is afraid of gaining weight. Okay, so our patient is afraid of gaining weight and eat only cereals and vegetables. Her weight is 44 only and her body mass index is 17. She complains of a right foot pain and X-ray of her foot is taken. It's given here. The relevant lab findings are followed. So HB 10.8, hematocrit 33.5%, mean corpuscular volume MCV 78.5. Okay, so this is the case given here. So 16-year-old girl we have, and she has a complaint of her mother is that rapid weight loss and erratic behavior. Okay, and she stated that she is afraid of gaining weight and only eat cereals and vegetables. Her body mass index is very low, and the X-ray of her foot is given here, her right foot. So what can you see in this X-ray? So here we can see the will be the diagnosis of this patient. What will be the diagnosis of this patient? The patient is afraid of gaining weight. She has her BMI 17 only, her weight is 44 only, and she has erratic behavior and rapid weight loss. So she is suffering from the anorexia nervosa. So let's begin. So anorexia nervosa. What are the other symptoms of this condition are common at this presentation? The patient typically present with a severe weight loss. As we have seen in this case, the patient had rapid weight loss as said by her mother. Then we have got one symptom here. The patient presents with the severe weight loss. Okay, and the body weight less than 85% of the ideal body weight, that is less body mass index. Okay, then multiple nutritional deficiency will be there. Despite being underweight, anorexic patients are obsessed with the calories. Okay, our patient is underweight. She has only 44 kg weight. Then, despite of being underweight, they are obsessed with the calories, preoccupied with dieting, intensely fearful of getting weight, gaining weight. Okay, so as we have seen in the question, she was afraid of gaining her weight, and she has only 44 kg weight. So, dental caries and erosions may be present if the patient are also inducing vomiting. So, what happens in this kind of patient? They try to induce the vomiting because after dental caries and erosions may be present if the patient are also inducing vomiting. So, what happened in this case? The patient tried to induce the vomiting. Okay, so due to the dental caries and erosions may be present. Additional purging via laxatives abuse may cause palpitation, lightheadedness, and chest pain due to electrolyte imbalance. So this is given here. So this is a dental erosion given here, which is caused by induced vomiting, and a patient may also have laxative abuse. So that's why they can have the palpitation, lightheadedness, chest pain during and due to electrolyte abnormalities. So these are the findings in the symptoms. See here, the patient is underweight and she is still obsessed with gaining calories. Okay, so these are the symptoms we are going to see in this patient. Going to the next slide, we will see what is the Russell sign. Okay, the Russell sign is very important. What does this patient do? The patient try to induce vomiting by repeatedly sticking their finger into their own throat. So figure is given here. So we can see here the scarring on the knuckles of this patient. So here is the diagram. So this is called as a Russell sign. Disorders, eating disorders. It is related to the eating disorders like anorexia nervosa. how the condition differentiated from bulimia. You have heard about bulimia also. So how we can differentiate bulimia and anorexia nervosa? The bulimia nervosa can present with the findings similar to the anorexia. Its hallmark is uncontrollable binge eating followed by purging. So here what happens in bulimia? Uncontrollable binge eating followed by purging. So this is a hallmark of the bulimia. This thing differentiate from the anorexia nervosa. The patient with the bulimia usually have normal weight. Okay, so they are not underweight. So this is important. The patient with the bulimia are usually present with a normal weight, irregular menses, nutritional deficiency, and these are uncommon. Okay, so this is how we can differentiate bulimia and anorexia nervosa. So we have seen here what is the result sign. The patient tried to induce vomiting by repeatedly sticking fingers into their own throat, and they got scar on the knuckles. And then we have seen how can we differentiate bulimia and anorexia nervosa. Okay, what kind of anemia does this patient likely have? Low hematocrit and low MCV. Low hematocrit and low MCV suggest that microcytic anemia most likely due to iron deficiency. So in this patient, the patient is most likely to have a nutritional deficiency. So related to the iron deficiency, most common feature in this patient with anorexia, inadequate vitamin B12, then folate intake called macrocytic anemia. Okay, there can also be macrocytic anemia due to inadequate vitamin B12 and folate intake. Some patients may have overall normocytic anemia due to combined microcytic and macrocytic anemia. So, overall, we can say here that patient is having nutritional deficiency, so they can have the all types of anemia, mixed anemias, macrocytic, macrocytic, or the combination of both anemias. What nutritional deficiency may contribute to the radiographic findings in the figure? Okay, so we have got one X-ray in the case. Okay, they are talking about if the patient was having right foot pain and they have given the X-ray. So we can see in this figure the patient has the fracture of the metatarsal. Okay, so what do you think? What can lead to this condition? The patient, as we can see, there are so many nutritional deficiencies in this patient. The patient is not eating well. Uh, the patient is eating only cereals and vegetables, which might lead to the vitamin D deficiency, calcium deficiency in this patient, and this can lead to the osteoporosis in this patient. Okay, the fracture of the fifth metatarsal bone is anorexic patient are often related to the part. Okay, part to the osteopenia and osteoporosis. So these are and secondary to the vitamin D and calcium deficiency. So in this patient, there is going to be deficiency of the calcium, vitamin D. So this is one of the reason to the osteopenia and osteoporosis and fracture taking place. Okay. Then what region of the brain regulate appetite and it thought to play the role in eating disorder? So there is a feeding center located in the lateral nucleus of the hypothalamus. When stimulated, it promotes eating. Okay, so we have got two centers in the brain. First is feeding center, and second one is satiety center. So what does the feeding center do? Feeding center, when stimulated, it promotes eating and appetite. And opposite to it is satiety center. Satiety center is located to the ventromedial nucleus. When stimulated, it signals the body to stop eating. So these both are important. So it it maintains the balance between our appetite. So lesion to this area can cause hyperphagia and obesity. Okay, so lesion can cause hyperphagia, obesity in these patients. Then, what is the treatment and prognosis of this condition? So, how we are going to manage the patient of anorexia nervosa? The only thing we can manage this patient is by psychotherapy. Okay, the multidisciplinary treatment approach focuses on restoring patient to the healthy weight and uses psychotherapy to correct the thoughts and the behavior. So this is only way how we are going to manage the patient. First, we are going to apply psychotherapy and this is the management of this patient. Okay, so this was all about the anorexia nervosa. We have seen the treatment is psychotherapy. Then uh, there are two centers in the brain, feeding and satiety center, which regulate our appetite and which balance between the eating food and maintaining balance of our appetite. Then we have seen what kind of anemia taking place in this condition. So due to lot of nutritional deficiency, the patient can have any type of anemia. Then we have discussed the radiographic findings. So this is a secondary to the vitamin D and calcium deficiency. Then this is important. This is very important. What is this? This is a Russell sign. Okay, the Russell sign, you must know this Russell sign, the scarring on the knuckle. The patient try to induce the vomit. Then what is the difference between the bulimia nervosa, anorexia nervosa? So in bulimia nervosa, we have seen the uncontrollable binge eating followed by purging, and the patient of the bulimia um, means present with the normal weight. Okay, then so this was all about this. We have seen the symptoms of this patient. Then dental erosions may be present as given in figure. Erosion, so dental scarring, erosions may be present to induce vomiting, purging, laxative abuse. So we can have the laxative abuse in these patients. Okay, so this was all about the anorexia nervosa. Hope you understood it. So this was all about the treatment, the symptoms, deficiencies, signs we are getting in these patients. Okay, so hope you understood it. Okay, bye.